Time for that Fox 4 House Call with Dr. Andy, and this morning talking about autism. It's almost the end, actually last day of April, Autism Awareness Month. And a new study just came out that might shed some light on this disease.
Right. This was reported in a recent edition of the Journal of the American Academy of Pediatrics. And it basically is the first time that researchers tried to identify a link between autism development and very premature babies.
And we're talking not babies born a few days early or a week early, but extreme preemies.
Right, not even a month early or even 2 months early. We're talking about kids that are born 2.5 months plus. So these are kids born at 23 to 30 weeks. And a normal pregnancy is about 40 weeks. So these are kids very early.
And this study showed that they might be more predisposed to autism.
Exactly. What they did is they looked at about 100 kids, actually a little less, about 91 kids, and they tried to identify various risk factors that would cause certain of them to develop autism-type behaviors down the road. They screened them at birth, and then they followed them for about 2 years.
And what's the benefit of this study? I mean, how does that help us treat the disease, or does it just raise awareness?
Well, it does both. It raises awareness. Most importantly, this is one of an initial group of studies that are going to be looking at types of risk factors, and the goal is to identify kids before they develop outwardly, obviously outward signs of autism, so that you can screen them ahead of time and ideally initiate treatment ahead of time.
And there's some proof that early treatment can at least help ward off some of the more severe autistic
Exactly.
cases.
It definitely improves outcomes. Earlier we can identify and treat, the better.
What are some signs parents might be going, okay, like the behavioral signs of like not talking or anything? Like when do you become concerned? When do you screen your child?
Well, I would say at the first sign of any concern, talk to your doctor, talk to your children's doctor. Autism itself can be very confusing. The definition is actually a dynamic definition. It's in flux because it changes every few years. Currently it's described as a neurodevelopmental disorder. So what that means are kids that have difficulty with socialization or communication or behavioral problems. These can include speech or developmental delays, difficulties with repetitive behaviors, sometimes even self-injurious behaviors, hitting themselves, and kids that are really difficult time with change.
And so maybe if you notice your child having those, definitely get screened by a doctor.
Right. It usually becomes obvious by a year and a half that something isn't just right with your child. But a lot of kids these days are being homeschooled, so they may not have as many interactions with other kids. And that means the parents don't necessarily know what the difference between normal and abnormal.
Hot topic, and then we'll of course hear more studies on autism. There's always changing information. We'd like to ask you to send us your questions. If you have a question for Dr. Andy, we'd love to hear what it is. Love to make it part of this segment. So go ahead and first, if you have questions about this segment, you can email Dr. Andy at info@drandy.us or give him a buzz 694-6246. But all those questions, go ahead and send to us. We'll get them to Dr. Andy. We'll discuss it and maybe get them on the show here so we can get them answered for you. Fox 4 Rising at fox4now.com. And it can be anything medical. We're going to test Dr. Andy's knowledge.